We are treating Mrs. Casto. Well, we used to treat her for a number of different things. Cervical radiculopathy. She's got a lot of pain still in her wrist here, so we're just finishing off a couple of more treatments with all of the energy focusing primarily in this area. On a scale of 0 to 10, you said you're right about a 4 or 5 right now? Okay. And after your last treatment, kind of stayed the same, and then when did it start to feel?
It got worse, actually, for about 2 days.
Okay.
And then it was like miraculous.
It just shut off and it was feeling better?
It was feeling much better. It still has its little catches, and it still only burns a very short distance now.
Okay. Okay, so I'm going to start treating from up here down the arm, because one of the things that with radiculopathy down the arm, we have to kind of treat the nerves that are running down, that come out of the back of the neck, down the shoulder, into the arm, and into her hand. So by doing that, we're increasing the circulation in all of those areas, and we're stimulating the cells and the nerves so that they can begin the healing process. And it's also reducing any type of inflammation that she has in this area, which will help relieve the pain that she feels in her wrist and in her fingers and her thumb. And you had mentioned before that you had trouble writing with your hand.
I couldn't really hold on to a pencil or pen, and had my husband bring home a big, wide-spaced tablet so that I could start learning to do my signature with my left hand. I was afraid
Because
I wouldn't
just
be
holding
able
the
to.
pen was
It
too
hurt.
hard for you?
Yes. And adding pressure. Adding pressure to the pen.
Are you still trying to learn how to write with your left hand?
No longer. I can move that thumb. I can
That's
hold
wonderful.
that pen.
Good, very good. So throughout her treatments, the laser has been successful in treating those nerves running down into her thumb and into her fingers, that actually controls how much pressure and movement she can get with those. So we've been able to increase the range of motion in her fingers. She's able to bend her hands, open her thumb, and grasp a pen again. And for you, during the treatments, normally the patients claim that the treatments feel very soothing. How would you describe the treatments during the treatment? How does it feel?
It just feels very warm.
Very warm?
Not too hot.
It's not painful at all?
No, not painful at all.
And how do you feel after the treatments? Do you feel like you're able to just resume your normal day?
No, I'm usually very tired afterwards. And really what I want to do is go home and lay down for a while.
And the reason for that is when your body is healing and it's stimulating those cells, it draws a bit of energy. So actually we have had some patients come down very ill with the flu or with a really strong cold, and we've actually canceled their appointments because your body needs that energy and able to heal. So if you're already really sick and your body's trying to fight off that cold, coming in and doing a treatment is only going to draw more energy and make it even more difficult for you to heal and fight off the cold and to heal the areas that we're trying to treat. So that's why you feel tired at the end of the treatment. A lot of patients say that they're going to go home and sleep really well.
Well, I also feel that the next day or so I try not to use the wrist as much. You know, try not to, I don't know, I wouldn't go wash windows, for instance.
Resting that area is always the best. You know, a doctor would tell you if you come in with a cold, they'll give you a prescription and say go home and get plenty of rest. And the reason for that is your body is going to heal when you're resting. So if you're going out and you're, you know, doing a lot of work with your hand, you're not really allowing your hand to heal and get the full benefit of the treatment.